Hello, good morning. This is Mike Berkeley, the founder and director of the Berkeley Center for Reproductive Wellness here in New York City, Midtown Manhattan. So I'd like to speak to those of you who have a history of endometriosis and have had either one or more laparoscopies for the purpose of getting pregnant. This means that you didn't necessarily have pain, or maybe you did have pain, but your main goal was to conceive, and your tubes were open, and there was no scarring on the tubes, but you had endometriosis, and that was creating a barrier to fertility, if you will. And so you had one or more laparoscopies, followed by multiple attempts at intercourse, followed by several in vitro fertilization with embryo transfers to no avail. Why not? Why didn't it work? Why didn't you get pregnant? Why are you not pregnant? Here's why. Endometriosis, first of all, is an inflammatory disease, and you'll hear doctors say that endometriosis is a disease that is one which occurs outside of the uterus. And of course, this is in fact true. However, the uterus is greatly affected by endometriosis. Why? Because endometriosis is an inflammatory disease where something called pro-inflammatory cytokines, you can think of these as inflammatory factors, find their way into the uterine cavity, making it hostile to an embryo and thereby rendering one infertile. So why is it that after a laparoscopy, many thousands of patients still cannot get pregnant? Here's why. Endometriosis typically has discolored tissue. It can be black and gray, it can be red, it can be purplish. And so when the laparoscopic surgeon is doing a laparoscopy, he or she will resect or cut out that tissue which is, for lack of a better term, miscolored, inappropriately colored. However, here's the interesting part. Some endometriosis looks exactly like normal, healthy tissue. So the surgeon is not going to resect normal, healthy-looking tissue. So in essence, after the laparoscopy is done, many patients still have endometriosis and still have pro-inflammatory cytokines circulating in the uterus, rendering it a hostile environment for an embryo to implant in. So with the utilization of acupuncture and herbal medicine, this can often be overcome. How? Why, you may ask? Because one of the interesting factors about acupuncture and endometriosis is that by utilizing the proper acupuncture points and the proper herbal formulas, these inflammatory cytokines or this inflammatory state can be significantly reduced to thereby render the uterine cavity more healthy and thereby more amenable to facilitating an implantation of an embryo. If you'd like to find out more about how we can help you to get pregnant, if you are one of these patients, please feel free to give us a call to schedule your consultation. We're at 212-685-0985. Of course, our website is berkeleycenter.com, which is BERKLEY center.com. I want to leave you with this. All is not lost, and help is available, and this game is not over. So keep your chin up and stay positive, be hopeful, Give us a call. Let us intercede on your behalf. Let us make your dream of family a reality. I look forward to meeting you and to helping you. Speak to you soon.